should be experts in preventive care. And that's what a lot of what we do is just making sure we're doing our screening test on time and that we're doing a lot of education on preventive care. But in order to do that, you need to know what to order when. So these first couple of modules here are going to deal with wellness exams for women and children. You each are assigned a woman of a different age and a child. And I want those templates for your SOAP notes to be very complete. For instance, in an infant, you would not expect to have the anterior fontanelle closed. But you need to know what it should feel like in a normal infant. Okay? What muscle tone should be normal in a 2-week-old, for instance. What should a vaginal exam look like on an elder woman versus a young woman? What tenor stage should a child be at, and what does that mean? What does that look like? For, say, a 18-year-old or whatever. So what should that look like, and tell me about it. The screening tests that they're going to need, whether they're going to need eye exam, whether they need hearing exam, whether they need any kind of lab work. Do they need to get their hematocrit checked? Are they older? Do they need to have a lipid check? When do we start checking lipids? And it's not very old, right? We start early, depending on risk factors. What vaccines do they need at different ages? And these are normals. So what you're going to do is do this for a normal exam, like the person is perfectly normal. They just need their routine care. So when you write up their exam, their muscle tone should look normal for their age. Their skin assessment, their everything. I hope you get the idea there. We're also doing a drug test in this first week, and that's because, with children, we do drugs based on weight. So you need to know how to do that. And it's pretty simple. If you can do simple math, you should be able to do this. But I've got several questions in there because I want you to do that. When you do drugs, if you do a drug for a child, you need to know the weight-based range, right? For instance, if you're doing amoxicillin for an otitis media, pretty much first line we use 90 to 95 milligrams per kilogram per day. We used to use 45, and in fact, years ago they did 25. 45 is not really used very much anymore because there's so much resistance, but you need to know that, okay? Meningitis, you'd use 200 milligrams per kilogram per day. So you need to know those kind of drug dosing and how to calculate it. And the max dosing too, okay? So then you're going to go through the well woman exam too, which is also kind of the same thing. Then we're going to do pulmonary. Now some of these things I have, you won't see them because they're blacked out on you. So there's not a check mark, you don't have to do it. But I have questions in here, and some of them I have that's a question bank, okay? Some of them I have projects for you to do, discussion boards, that sort of thing. So, I'm sure they published that one. Anyways, I have different things for you to do in here, and I have resources and stuff. So I've tried to change it up a little bit. So you do, sometimes you do a discussion board, sometimes you're doing a sheet, like a diagnosis sheet. Sometimes you are just doing quizzes. Okay. This is just like every class that we have here, is a lot of material to cover in a short amount of time. And I wish that I knew a way that would make it easy, but this is just hard work, and it's painful hard work because there's just so much to learn. I've tried to give you lots of reading resources. We're trying real hard to get away from having you buy a lot of textbooks, especially ones you won't use. I haven't found a really good women's textbook, so I just got rid of it this time, and I'm giving you articles instead. The Pete's textbook is the one that's generally used by most places. It's okay. It's pretty good. Based on textbooks, it's probably better than some of the others. You will also need to know your DSM-5 criteria when you're talking about mental health problems. So if you're going to diagnose a child or a mother or somebody with postpartum depression, you need to know the DSM-5 criteria. And also remember, we screen for postpartum depression in every visit in the first year of life. That's something new that came out last year. So every baby visit first year of life. So remember to include those in your baby wellness exams templates. Anyways, there is a lot to learn. Hopefully this will all go well and you'll see the value in it. That's definitely my plan for you guys. But if you have any questions or suggestions, just let me know. And then there is always the possibility, if you don't want to do any of this kind of work, you'll have to do the wellness template, because that's just, I think it's real important. But if you wanted to not do any of the other work and just make the midterm and the final count a lot, you're welcome to do that. Just need to talk to me about it, and we can figure out the values. All right, I haven't had many people take me up on that because it's kind of a high risk type thing. Anyways, I hope this semester goes well. Talk to you later.